Gynecomastia in teenagers or adolescent gynecomastia. This is a topic that we are discussing in continuation with our gynecomastia topic. And what are the causes, how we have to deal with it, and when do we need to operate. Hi, I'm Dr. Hiranmayi Jha. I'm a cosmetic plastic surgeon and I'm practicing at EVA clinic located at Shivalik Malviya Nagar. We deal with all the cosmetic surgeries, hair transplant, laser and LASIK center. So today I'm discussing about the gynecomastia in adolescents or teenagers. So gynecomastia is a benign proliferation of glandular tissue. Gynek means female, mastos means breast. So basically the breast tissue which looks like females, and it is present either on one side or both the sides. It can occur suddenly, which is an acute presentation, or it can occur as part of chronic presentation, slow onset. Coming to the incidence, there is approximately 4 to 69% of incidence in the population of adolescent gynecomastia. It can present as early as 10 years or it can go till 17 years. However, most of the cases get resolved. 10% of the total boys who have presented with gynecomastia are left with the gynecomastia at the age of 17 years. And a period of 1 to 3 years is when we should observe these cases. So, for all the cases of teenage gynecomastia or adolescent gynecomastia, we do not need to operate. Observation and assurance is the only thing which needs to be done. Now what happens? Most of the cases there is imbalance of the hormones, estrogen and testosterone. And we need to do a complete hormonal profile which includes estradiol, testosterone, gonadotropins, prolactin and thyroid function tests. There is another story to it that sometimes the entire thing or most of the cases we see that the entire hormonal level is normal, and it's the sensitivity of the estrogen hormone which is increased in these tissues, because of which we see the proliferation. So we have to observe at least for a period of 1 to 3 years. In these cases, 75 to 90% of all the adolescent cases get resolved. So when does surgery comes into play? Surgery is indicated in all those cases where there is a lot of physical symptoms or emotional distress is there. So in those cases, surgery comes to a play. And even those cases where after a waiting period of 1 to 3 years, the symptoms have not resolved, in those cases also we need to do surgery. So I hope you're clear when you need to go for what treatment in all the cases of adolescent gynecomastia or gynecomastia when it is encountered in the teenage population. Thank you.